asked yourself why some people are born twins, some triplets, some quadruplets, or even more, and others are born single, or how that even happens? That is what we're about to find out today on The Psychologist Andy with me, Dr. Blessing Ntamu. We're talking about twins and multiple births. Before we go further, if you haven't subscribed to this channel yet, just look beneath this video playing right now. You see the word subscribe. Click on subscribe and also click on the bell sign to enable notification so you'll be notified of all our future videos. You don't want to miss any of these interesting and educational videos. Okay, so twins and multiple births. And in order to enhance your understanding of twins and multiple births, there are some concepts you need to have a grasp on. So we're going to go right ahead to discuss the concept of ovulation. Now, it's important to note that when a girl child is born, she does not immediately become reproductive. She has to grow up to puberty, and then she becomes reproductive when she hits reproductive age. Okay, between the ages of 9 and above, now puberty sets in for females. Now, the girl child experiences her first menstrual cycle, known as menarche. Now, by the time she experiences her first menstruation, it also means that she has experienced an ovulation. So, what is ovulation? Now, ovulation is a process by which either of the ovaries of a woman releases an egg once in a month to be fertilized by the sperm cell, if there's sperm cell available to fertilize it. So, once in a month, either of the two ovaries that a woman has will release an egg that could be fertilized by a sperm cell. Now, the normal menstruation or menstrual cycle for a woman is a 28-day cycle. Ovulation would usually occur on the 14th day of that cycle. That's in the middle of the cycle, the woman ovulates, and the egg cell can last for about 24 hours or thereabout, before it becomes dissolved. So within the period of ovulation, if the female has sex and there's sperm cell available, it will fertilize the ovum or the egg that was released by the ovary, and then the woman will become pregnant. Okay, now let's take a look at this diagram from my first edition of my book, The Unique Teenager, and let's see if I can help you understand this better. So what you can see on the screen there is the female reproductive tract. Okay, this is the female reproductive tract. What you have here are the kidneys, a pair of kidneys, and we're really not concerned about that today. But if you look down, you see another pair of egg-like structures. This and this, these are the ovaries of the woman. So every normal woman has two ovaries, 1, 2. Okay, now once in a month, either of these ovaries, either this or this, normally not both of them at the same time, either of these ovaries will release an egg, and the egg will fall into the ampler region of the fallopian tube. And then if the girl child had sex, this is the vagina, the penis will be inserted into the vagina during sexual intercourse, and sperm cells in their millions will be released into the vagina. They will travel through the cervix, through the uterus, all the way to the fallopian tube. It is here in the fallopian tube that fertilization of the egg cell will take place. So the sperm comes into the vagina, swims through the cervix, through the uterus, and gets to the fallopian tube to fertilize the egg. It's a game of chance. Millions of sperm cells are released in here. Not all of them get to the fallopian tube to fertilize the egg. As a matter of fact, science has helped us to understand that the distance from the vagina to the fallopian tube is like crossing the Mediterranean Ocean or the sea several times. It's a long distance, and not all the sperm cells will make it down there. So the first sperm cell that makes it to the egg cell that has been released and is waiting fertilizes the egg cell, and immediately fertilization occurs, the outer layer of the egg cell, is changed so that another sperm cell cannot penetrate to fertilize it again. The fertilized egg now, fertilization occurs, like I said, in the fallopian tube, and then the fertilized egg will travel back again down and will be implanted in the uterus or the womb of the woman within about 14 days. I hope you're following me. So we have two ovaries. Every woman has two ovaries, And once in a month, one of these ovaries should release an egg normally, and this egg will drop into the fallopian tube around the ampulla region, and then if there is sex during that period or some days to that period, there will be sperm cells available. They will make their journey all the way through the vagina, through the cervix, into the uterus, and all the way to the oviduct or the fallopian tube to fertilize the egg. The fertilized egg or the zygote will now travel back again down to be implanted in the uterus. I hope we get that clear. Now, so what happens when there is no sperm cell available to fertilize the egg? If there's no sperm cell available to fertilize the egg, after ovulation, the egg would normally last for about 24 hours thereabout, after which it will be dissolved. Okay, and then the egg cell, the remains of the egg cell, and all of the deposits in the uterus will now be flushed out of the vagina as menstruation, the particles that we see, the blood that we see. Okay, that's what happens. One of my professors in the university calls that the weeping of the womb. So he calls menstruation the weeping of the womb. He said because so much had been done to prepare for a baby, and when that does not happen, there's no conception, there's no pregnancy, the womb weeps, and that's why there's menstruation. So what is menstruation? Menstruation is the monthly washing away of the inner lining of the uterus of a woman. Usually what is washed away is made up of blood and tissue, broken down tissue. Before the girl child menstruates, the uterus prepares for eventual pregnancy, and so a lot of tissue is being deposited in the inner lining of the uterus. When pregnancy does not occur, when there's no conception and implantation, all of this tissue that was deposited around the uterus, including the broken down egg cell itself, will be washed away as menstruation. And like I said, one of my professors that taught me physiology in school usually calls it the weeping of the womb. So I hope you understand this now. 2 ovaries, either ovary will release 1 egg a month that can last for 24 hours. If there's sperm cell available, there will be fertilization of the egg cell, and then there will be implantation. Okay, now all of this complex process, and not every egg that is fertilized gets implanted. That's why sometimes we have miscarriages, and sometimes we don't even know when we have miscarriages. Okay, yeah. Now it's also good to note that it's not only on that one day that ovulation occurs that you can get pregnant. Okay, so if you have sex from about 5 days before ovulation or up to the day of ovulation, you can get pregnant, because the sperm cell can survive for up to 5 days, after it has been released into the vagina. That being said, we're talking about twins and multiple births. So this is what happens. We have 2 types of twins. We have the monozygotic twins, and we have the dizygotic twins. Now, the monozygotic twins are also referred to as identical twins. Monozygotic twins, identical twins. Okay, I will get back to that shortly. The second type of twins we have are dizygotic twins. Dizygotic twins, or unidentical twins. Dizygotic twins are also called unidentical twins, and they are also called fraternal twins. Okay, now monozygotic twins or identical twins usually look identical, as the word goes. They look alike because they share exactly the same genetic material. Dizygotic twins may not be identical because they do not share exactly the same genetic material. Now, monozygotic twins will always be the same sex. Identical twins or monozygotic twins will always be of the same sex. But dizygotic twins or unidentical twins or fraternal twins may not be of the same sex. I hope you're getting me. Now, this is because monozygotic twins are formed after a single egg has been fertilized and then divides. Okay, so we had mentioned that every woman, normal woman, has 2 ovaries, and the usual thing is that once in a month, one of these ovaries should release an egg. So if the ovary on the left-hand side releases an egg this month, the one on the right will not release, and then the next one, that one will release. They alternate, 1 egg at a time. Now, when this egg is released and it gets fertilized, perchance or sometimes that already fertilized egg undergoes mitosis, undergoes a mitotic kind of division. So the egg was released by the ovary into the oviduct. One sperm cell fertilized one egg cell. Then after fertilization, there was division. So if that fertilized egg divides into two, you have a pair of identical twins, two identical twins. If that fertilized egg divides into three, you have three identical twins. If it divides into four, you have four identical quadruplets, three identical triplets, and then identical twins. I hope you understand that. Now, sometimes both ovaries will release an egg each at the same time. So the left ovary releases one egg, the right ovary releases one egg at the same time. So there are two eggs available. Because you have millions of sperm cells, it is possible for both eggs to be fertilized. Now, so if two eggs are released, perchance, it doesn't happen all the time. This is not supposed to be the usual situation, but sometimes it happens that both ovaries release an egg each. So there are two eggs available. There are usually a lot of sperm cells available, so both eggs will be fertilized. Now, if two eggs are released and these two eggs are fertilized at the same time, then you have unidentical or fraternal twins, dizygotic twins. That's because they are not formed from the same zygote. Monozygotic twins are formed from the same zygote. First of all, there was one sperm cell, one egg cell, there was fertilization, one zygote was formed. And after the formation of that zygote, there was division into two or three or four. That's monozygotic twins from the same zygote. Now, dizygotic twins are not formed from the same zygote. Like I just said, dizygotic twins are formed when two egg cells are released and they are fertilized by two different sperm cells, two egg cells, two different sperm cells, and you have two zygotes. So you have two individuals born at the same time but unidentical. They do not share exactly the same genetic material. They might share about 50% of their genetic material, just like other siblings. So they don't look alike really. Okay, so we have monozygotic twins and dizygotic twins. Now, it is also possible for you to have these two events occurring at the same time, multiple births. Some people give birth to 7 children, some to the septuplets, some quintuplets, and all of that. So what can also happen is that you can have both ovaries releasing an egg each at the same time, and then these two eggs are fertilized at the same time. After fertilization, probably one of the egg will remain as it is, and then one of the eggs will again split into multiple. So you can have one egg after being fertilized splitting into 5, and then this other egg was released at the same time with this egg. It was fertilized but it did not split, in which case you will have 6 children, sextuplets, and then you have this one being different from the others and the other 5 being identical. So multiple births can occur like that and in several numbers. So you can have 2 eggs released, 2 eggs fertilized, this splits into 2, this splits into 3. So you have 5 children, 3 identical on this side, these 2 identical, the same sex. When they're identical and from the same zygote, they will have the same sex as well. I hope that you understand me so far. Like I said, please subscribe to this channel and then get into the comment section. If there are questions you want to ask, anything reproduction at all, get into the comment section and leave your questions. I'll be very glad to respond to them as soon as I am disposed. Okay, yeah, so leave your comments, leave your questions, like the video, and let's move on. So now also, what increases the chances of an individual having twins? Okay, now there are certain factors that increase the likelihood of an individual or of a couple having twins. The first one is genetics. Now, if twins runs in your family, there are some people in your family that have twins, or yourself, you're a twin, you're very likely to have a pair of twins or a set of twins or multiple births. Okay, that's one thing that increases your chances of having twins. The second one they've said is the age of the woman. Now, the older the woman, the more likely for her ovaries to release more than an egg at a time. So older women are more likely to have multiple births than younger women. We'll talk about age and reproduction in the future, more about it. Now, another factor that can increase the likelihood of you having multiple births is also your height. If you are of unusual height, like some researchers have said, if you're unusually tall and you also have a big body mass, okay, you also have unusual weight, you're also more likely to have twins or have multiple births. Now, the last factor that could influence you having multiple births is when you take fertility pills. Okay, those who take pills to enhance their fertility, usually that also causes them to have multiple births. Like I said, this topic usually is a very interesting one in class, and there are usually thousands of questions, a lot of questions in class. I'm expecting to see you ask your questions in the comment section, and I'll try to explain them. It depends on the number of questions I have. I probably will do another video to ensure that everyone understands and follows me. But for now, I expect to see your comments and your questions in the comment section. Been another wonderful time out here. I'm enjoying doing this, and that gives me kind of a lot of satisfaction. I just enjoy the fact that I'm able to share what I know and to keep my brain working. I hope you don't stop learning as well, and I hope you enjoy these videos as much as I do. Don't go without subscribing to the Psychologist NG TV. It won't cost you a thing. Just click on the word subscribe beneath the video, and also please like the video, please leave your comments, and why don't you follow me on Instagram at the Psychologist NG. I want to connect with you, I want to interact with you on a more personal level. Also, you can follow me on Twitter at the Psychologist NG. Thank you for staying through, and have yourself a very beautiful day out there. God bless you.